I would go on family vacations and I would have to use a cane, or if I had to go long distances, I would have to be in a wheelchair. I was in pain 24/7.
I had never met Kat before, and I went to her place of business and noticed that she was limping and that she had a knee brace on. And being that I'm a curious physical therapist, I asked her what her history was, and she had told me that she had had 4 surgeries. She was unfortunately getting ready to go to Boston to do a 5th one, so I said I might have another option for her to look into.
When I met Terry and she told me that there might be another option, it was like a glimmer of hope.
She came over with medial compartment or inside part of the knee pain from not having a meniscus. We thought she was an excellent candidate for a meniscus allograft transplantation. That involves a procedure where we take a meniscus from an organ donor and transplant it into the patient, in this case, Kaitlynd.
Honestly, it really caught me off guard that such an awesome opportunity, a group of doctors and of course physical therapists were here right in Rhode Island, because I had been traveling for 10 years to Boston because that's where I thought I was going to find the best. And I was pleasantly surprised to find that I really did find the best here in Rhode Island. My experience with Dr. Owens was amazing. He was actually the first doctor in over 10 years that actually sat down and explained to me what was happening in my knee.
She did very well. It's a very complex procedure. I do a lot of them. My group does a lot of these procedures. In general practice, not a lot of people will do them because it is certainly a technically demanding surgery. We size match the graft from the organ donor, and then we have to bring that through. I do it arthroscopically as well. It goes through small holes in the knee joint. We're able to bring that graft in and secure it to her tibia, and then secure it to her capsule as well.
Yep, this is right. Physical therapy started about 2 weeks after surgery. She was here for about 6 months, and she continues with her workouts to this day. She knows it's something that is a long-term process. She has a knee that underwent 5 surgeries in 10 years. She's extremely young to have that much work, so she knows that she's going to be at it for the rest of her life, really, in some sort of way.
Therapy is a huge part of any surgery, especially something complex like a meniscus allograft transplantation. And Kaitlynd did fantastic. A lot of that is the therapist, is being able to have the therapist that has that close, tight-knit relationship with you and is able to walk you through the rehab protocol. And she was able to show her the things to be worried about, the things not to be worried about, where she could push and where she needs to scale back.
And she was thorough and she really cared about my wellness and my well-being, and that was something that was really different for me. I really hadn't experienced a physical therapist that really was by my side through the whole thing, and I really felt like the whole time it was okay. I could push my limitations because I knew Terry was there to help me.
Knowing how frustrated, how much pain she was in, how she was at the end of a rope, she really didn't know what else to do. So to see her from that bottom to where you really wouldn't know she even had surgery is pretty awesome. Yeah, that's what makes you want to keep doing what you do when you see success stories like Kat's.
Your surgery took me an hour, but it took you 6 months. And when you want to look at, it's important to get the carpentry right, but it's nothing if you're not able to put the time in with the therapy. And she did. She worked her tail off, and it showed in her outcome.
Life-changing. I think that my physical well-being has completely changed my mental state on everything. I wake up every morning grateful that I can walk. I'm grateful that I have 2 feet to stand on and I can do things that I haven't been able to do and enjoy life much more than I could before. It was the greatest gift that I could have ever been given, and I am forever grateful.